be discussing the continued effort to give nurse practitioners more independence. Supporters say it's key to making healthcare reform succeed. We'll explain after the break. Right now in New York State, nurse practitioners can have their own offices, but they must be tied to a doctor through a written agreement. A pending bill known as the Nurse Practitioner Modernization Act aims to change that so nurses may practice independently. Yesterday I spoke with Stephen Ferrara. He is the executive director of the State Nurse Practitioner Association, to learn more. Mr. Ferrara, thank you very much for being here. Welcome back to Capitol tonight.
Thank you for having me.
So we've spoken about this issue a couple of times before, and you have the support of the governor, which is very important.
Yes.
Where are you with the legislature right now?
We are waiting to hear back from the Assembly and Senate in the one House bills. We know that we have support from the Assembly. The Senate, we've had positive discussions, and we're hopeful that the Senate will include a version of the governor's language in their one House.
Okay, so a version. So is it possible that we will be looking at some sort of amendments to the original language?
We very much favor the governor's language. What the final version looks like is anybody's guess at this point, but we're hopeful that we can stay as close to the governor's language as possible.
And just remind folks what that says, the governor's language.
So the Nurse Practitioners Modernization Act is the bill that's been inserted into the governor's budget. What this will do is allow nurse practitioners who have more than 3,600 hours of practice to practice without the requirement of a written practice agreement between a nurse practitioner and a physician. However, nurse practitioners will continue to have collaborative relationships with physicians or a hospital system so that nurse practitioners aren't practicing in a silo. We're still part of the healthcare team. We're not trying to be out there on our own.
But it won't be mandated in order for you won't need the mandated written requirement anymore.
There won't be that piece of paper that says I, as a nurse practitioner, need to collaborate with my collaborating physician. He or she needs to review so many charts over a certain amount of time. That goes away.
So when I last remember discussing this, the doctors were not on board. Are the doctors still not on board?
They're still not on board.
Okay. So is that seems to be a little on the dangerous side, because right now obviously is the lobbying time.
Sure.
And are they getting involved in the Senate? I would assume that they are.
I would assume so. I mean, we try to have continuing positive discussions. The Federal Trade Commission just yesterday released a report that says the states have to look at these scope of practice requirements for nurse practitioners particularly, and make sure that it's not a restraint of trade. It's not illegal sort of having one profession sort of dictate what happens to another profession.
So it seems that's positive at the federal level.
It's
then.
very positive.
Well, I would expect that the federal, at least the Obama administration, would feel positively about this, because we've talked about doctor shortages and an increasing number of people who are coming into the system, particularly into Medicaid when it comes to the Affordable Care Act, and you have an increasing number of doctors who are not accepting Medicaid patients.
Absolutely. We know that those numbers are low, very, very low, and not just Medicaid, but Medicare as well. Nurse practitioners are seeing those patients for sure.
So generally, as a matter of speaking, nurse practitioners are taking Medicaid patients, Medicare patients, where doctors are not. Don't they have the same insurance concerns, however?
They do. They do have the same insurance concerns. So all the concerns are still the same. However, the nurse practitioners have the evidence has showed that the nurse practitioners will practice in those areas that the physicians may not be in, because there's just a lack of providers in that area. So yes, the concerns are still there, but so far the evidence has proven that the nurse practitioners are taking those Medicare patients, are seeing those Medicaid patients. It's part of our community training. It's part of our education to be out there in the community, not necessarily be in the desirable areas that everybody would like to practice in, but to sort of be entrenched in the community where the people are.
So how was it that, I mean, this is the first time that the governor's actually included this in the budget. How was it that you managed to make that case, and how strongly do you believe that the executive feels about this issue? Because, I mean, look, budgets are about horse trading, as we know, and things fall off the table, at a given moment and get back on and then are off again.
Sure. Well, when the Medicaid redesign team came together, this was one of the major lead proposals that needed to that was suggested to happen. So we saw that back a few years ago when he assembled the MRT. So we think he's certainly committed to seeing this through and having this make an impact on the provider shortage that we're facing already today.
Does the awarding of the Medicaid waiver to the Cuomo administration by the Obama administration strengthen your cause?
It doesn't hurt it because there are enhanced payments for Medicaid, which would be somewhat across the board. So that certainly doesn't hurt. How much it helps, I'm not sure if it really is sort of, you know, the silver bullet, if that's what it is. And also, I mean,
at this point, you know, we're talking about a lot of moving parts in terms of healthcare. So I also wanted to ask you regarding the downstate hospitals, does that impact your membership?
Not as much. We're seeing that a lot of nurse practitioners not necessarily being part of hospital systems, being affiliated with a hospital for sure for those practices, but not necessarily being in the hospital. Will it have an impact? It will have some degree of impact, but we don't believe it's major.
And what about medical marijuana?
Medical marijuana. We do not have a stance on medical marijuana at this point. I think a lot of data still is out there that it really has not been shown to be proven effective, but we're certainly willing to listen and look at the evidence, because if it is a treatment that helps patients, well, we need to examine that. So there's no official stance that we have on it currently, but certainly we recognize that it could be part of the solutions to chronic pain management.
So, okay, so I understand that from an ideological standpoint, you don't have a position formally on medical marijuana, whether or not it should be legalized or not. When you look at the delivery system options, however, do you have a position on whether the legislative proposal would be more effective than the gubernatorial proposal, which of course is a more limited and some say cumbersome executive controlled program?
Right. Well, if it's out there, it should be made available. You know, if the decision is to make it available, it should be as easy as possible for those you know, defined people who need to get it. So how that looks in the one house budgets and how it ultimately looks, you know, we'll be examining that for sure. But certainly there should be less barriers to it if it is indeed made available to folks.
Yeah, I'm surprised that you guys don't have a position, actually.
Yeah, you know, it's just one of those things where it's been fairly fast-moving. We know it's been out there, and you know, we're looking at the other states, and they're just, you know, we look at the clinical trials, you know, the gold standard in trial, and there hasn't been a lot of data out there. We know anecdotally that it helps, but really, you know, do we want to be out there saying that, you know, we're advocating for this? We're looking at it. We're examining the evidence, the data. It certainly seems anecdotally to help. But as far as, you know, where we stand, we're still, you know, evaluating those things.
You may have to get a position quickly.
Yes,
because, you know,
exactly.
it is in the Assembly One House budget bill, and we will see. And apparently there are more senators who are signing on. So we'll catch up with you again when the smoke clears, so to speak. Thank you for your time. Liz.